Hi, I'm Janice Farnholz-Province.
And I'm Kelly Connell-Phillips.
And this is a quick video on how to use the perfluorine lipid microspheres, or Definity.
Definity is a contrast used to enhance the image of the heart on echo. The two vials on the screen are Definity. The one on the left is clear, and this is what it looks like when it's first pulled out of the refrigerator. The vial on the right looks like propofol, and this is what it looks like after it's been activated.
So use caution because this is a look-alike drug error potential.
We'll explain what being activated means in a minute. So what Definity is perfluorine gas suspended in a lipid microsphere, which is why it's white.
And here you see two different pictures of echoes. On the left, you see the heart with no imaging agent. And then on the right, you're able to see the borders of the chambers better with the use of Definity.
It is used for suboptimal echoes to improve visualization of the heart.
And people that potentially could have the suboptimal echoes are critically ill patients, intubated patients, or obese patients, to name a few. The echo tech is going to let you know that they have the suboptimal echo, and then they're going to ask you to help prepare the Definity for that patient.
Contraindications for using Definity are anyone that has a known cardiac shunt or defect, which is why we do the bubble study first to rule that out. Also, anyone that has a hypersensitivity to perfluorine gas, which is used in certain eye surgeries, so the chances of you running across anyone who knows that they have a hypersensitivity is going to be pretty rare. Also, Definity is only given by IV, never arterial.
Again, the echo tech is going to let you know if the IV that the patient already has in place is adequate. Usually an 18 gauge or 20 or 22 gauge is sufficient. 24 gauge IVs are no bueno. What needs to be done prior to injecting Definity is that it gets activated in this special Vilamix shaker for 45 seconds. It's kind of like the paint shaker that you use when you go to a paint store. Also, if the patient has a central line in place, that will be fine as well.
When you draw it up, use a 10 ml saline flush syringe and expel about 1.5 mils, and use a vented spike, or a large gauge IV, to draw up the Definity into the syringe. If you don't have a vented spike, which you can get from Central, you can use another large gauge IV to spike the vial as you draw it up. Then hand agitate the syringe to mix it well. Try to administer it within 5 minutes of activating. If there's a delay for whatever reason, just hand agitate it again and then it's okay to use. As you prepare to inject, listen for the echo tech to say, go ahead and inject. Inject about half a mil to about 3 mils slowly over 10 to 30 seconds and continue until the tech says stop. The rate is approximately 10 seconds per mil, and the echo tech will tell you how much to inject. You will be able to see on the screen pretty quickly the Definity as it enters the heart. This is not like the bubble study where you inject 10 mils. You use a much smaller volume of Definity.
The side effects are not common with Definity, but when they do occur, most often your patient's going to complain of a headache, back, or renal pain. And these usually happen within 30 minutes and then they subside quickly.
There are rare complications. Anaphylaxis and cardiovascular collapse have occurred, but again, very rare. So make sure resuscitation equipment is available.
As with any procedure, make sure to document all of the pertinence, including how the patient tolerated the procedure and the amount of Definity given. For more detailed information on how to administer Definity, there's a great tutorial video at the link listed below. Thanks for listening.